So, what are some common complications after an anterior total hip replacement, and what's the best thing to do about that? My name is Dr. Ron Miller of Pursuit Physical Therapy, and we see a lot of complex cases here, and we see a lot of these total hip replacements are going through an anterior approach, and some of the complications that happen with that. So, with an anterior approach, your main limitation is a lack of hip extension, and you can't stress the front of the hip. So, or the prosthesis pops out. So that's one of the complications with that. You're not going to be aggressive with getting hip extension or stretching hip flexors and stuff like that. So because of that, a lot of times patients will have some sort of hip impingement still going on, a lot of tightness in the quad and the front of the hip that builds up over time, and then they get something else going on like knee pain or some hip pain, or even sometimes the femoral nerve goes through there and they get some numbness and tingling. A lot of times too, even after the surgery, a total hip replacement's pretty aggressive. Sometimes the femoral nerve is even stretched and they get some quad weakness also. So that's a common thing too. But the good news is normally about after 6 months to 8 months, if everything's healed well and the prosthesis is in there good, then you can slowly start addressing some of these things by doing a hip flexor release. You can do some needling on some of the quad, the rectus femoris muscle, and you can slowly start getting that full hip extension back. And then once you start addressing those things, myofascial releases, stretching the rectus femoris, the iliopsoas muscle, getting full hip extension back, then a lot of these complications or side effects of getting the hip replacement done start to go away, and you get back to your daily activities without symptoms and pain and stuff like that. So those are some of the main complications that we see a lot in the clinic that are associated with a total hip replacement. Most of the time, it's an excellent procedure to get done. A lot of patients get excellent outcomes with it, and every now and then you see some stuff that creeps in as a secondary effect of it. So those are some of the complications or side effects of getting the anterior total hip replacement. And yes, there's always a root cause to your pain, so there's always a way to address this or treat it. And we see a lot of these cases here at Pursuit. If you're dealing with any of these complications, you can click on the link below or visit us at pursuittherapy.com. Thanks.